I'm Dr. Michelle Harvey. I'm a research dietitian at the Prevent Breast Cancer Research Unit at the Nightingale Centre in Manchester. We know that when people have been diagnosed with breast cancer, they have a lot of concerns about their diet and what they should eat.
There's lots of information out there about what is the best thing to eat and not eat when you've had breast cancer or afterwards, and it would be nice to know what is the best thing to do.
Since I've had my breast cancer, I've changed my diet slightly in the fact that I'm eating a lot more vegetables now. I'm not that keen, to be honest. I'm eating them because it's supposed to be healthy, but I'm not really sure if I'm doing the right thing because I'm not really that keen on them.
I've heard about the benefits of eating turmeric and brassicas, and also of avoiding some things like tea, coffee and alcohol, and I'd like to know which, if any of those, are true.
We've come here today to Altrincham Market with Sally, who's had breast cancer. We're going to do some shopping to help show you the right choices of food if you've been diagnosed with breast cancer and to dispel the myths.
Okay.
Yeah.
So do you want one or two?
So how would you cook those?
So,
So broccoli's amazing. It's got some chemicals in it called sulforaphane, which in the lab have amazing anti-cancer properties. Now, that doesn't mean to say that that bit of broccoli is going to necessarily fight your cancer, but doctors are actually now extracting the chemicals from here and turning it into drugs that they're testing in trials. So it's very, there's some interesting stuff in there.
as well?
Yeah, that's good. Yeah, no, they are good.
Oh look, turmeric. I've heard this is really good for you. Yeah.
But you need to eat so much turmeric
Yeah.
to have an anti-cancer effect. You're probably talking about having about 30 pots a day
Right.
to get anywhere near the doses that they're looking at
bit too
using.
much.
A bit too much, that's right. But maybe those mackerel look fabulous.
Yeah, no, they look good. What about you?
There?
I'm really pleased with that.
Yeah, okay. Should we go back to the Nightingale Centre and then see what we've got? Yeah,
Yep, that
okay.
sounds good.
All right.
Okay.
Right, so this is what we've bought and we've added a few things to it. We talk through some of the good things we've got here. So when you're thinking about your plates and your dinner, probably half your plate should be vegetables, really. The more variety of vegetables we have, the better. Your rainbow of colours is really important because you're getting all the different antioxidant and plant chemicals in there. So that's all great, including your brassicas, yeah?
Okay. And the potatoes and bread and sweet potato aren't vegetables?
But we count those as carbohydrates. So we want you to have some carbohydrate in your diet. And when you do, we'd rather you had the whole grain carbs. So things like wholemeal bread rather than white bread or whole grain cereals.
Yep.
And then we also want you to have protein foods. So you don't have to be vegetarian. So you can have, say, your fish, your eggs. You don't have to have fresh fish.
Okay.
Tinned fish is absolutely fine, or you can have your pulses, your dried pulses, even your baked beans is all fine.
And your brown bread.
Absolutely,
Yeah,
that's
beans on
right.
toast, actually.
Yeah.
We've got like coffee and sugar and things. So
Yeah. So coffee and tea absolutely fine. People often worry that they drink too much coffee, and it's a part of a healthy diet. It's got lots of healthy antioxidants and plant, again, these chemicals which we think have really good effects in the body. So coffee and tea is absolutely fine. However,
sweeteners there and sugar.
yeah, so we'd rather you didn't put a lot of sugar in it because sugar's really not good
okay.
for any of us. We'd rather people didn't have sugar. If you really can't do without sweet drinks, then you could use a sweetener.
Yeah.
But we're starting to have some concerns. They're not really confirmed yet, but we are a bit concerned that maybe having too much sweetener in your diet can affect the balance of the bugs that are in our guts, which might be bad for our overall health and possibly cancer risk. So I guess if you can do without sweeteners or sugar, that's better.
Right. Okay.
But given the choice, go for a sweetener.
And that's just got soya milk there.
Yeah, so a lot of people when they've been diagnosed with breast cancer think that they shouldn't have dairy in their diet and maybe switch to soy. So two things.
Yeah.
Dairy's fine. We'd rather you have the low-fat dairy because we don't want you to have too much of the saturated fat that's in the high-fat dairy foods like cheese or high-fat cheese or cream, things like that. So low-fat dairy's fine. So that's why we've got the feta cheese, which is one of the lower-fat cheeses.
Okay.
But soy is okay. if you want to have soy, that's fine. Again, a few years ago we were concerned that it stopped some of the cancer medications working properly, but we don't think that's the case now. So it's personal choice, either have dairy or soy, that's absolutely fine.
Okay. So I noticed we've got low-fat natural yoghurt and not low-fat yoghurt with fruit in.
So a lot of fruit yoghurts do have a full of sugar, you know. So a bit of natural yoghurt with some fruit, great breakfast, yeah.
And then what about wine o'clock?
You don't need alcohol in the diet. On the other hand, you don't need to stop drinking altogether. So drinking up to the 14 units a week is fine for most people. So you can drink sensibly and still enjoy a drink, and that's fine. Yeah.
And then snacks. I noticed we've got walnuts.
Yeah, have snacks, and obviously there are some unhealthy snacks. We'd rather you had a healthy snack, so maybe something like some nuts, like we've got here, which are full of the healthy fats and minerals that are good for us.
Is it better to go for nuts like this that aren't covered in salt rather than your salted peanuts and stuff?
So salt is not good for, not really linked to breast cancer, but it's not good for our blood pressure, not good for our bone health, which of course is important for women that have gone through breast cancer treatment. So we'd rather you had the unsalted nuts if you can. Yeah.
Right.
Okay, Sally, I hope that's been useful. I know it's been a quick rush through, hasn't it? But it's important to know that there is more information on these websites.
Great, I'll go and have a look.
Okay.
Thank you.